If you're over 70 or you care about someone who is, this video might surprise you, because some routine health checkups that were once considered essential might actually do more harm than good. Yes, even doctors are now raising concerns about certain tests that could lead to unnecessary risks, anxiety, or dangerous treatments in older adults. Let's uncover the 5 medical tests seniors should think twice about, and why skipping them might actually be the smarter choice. Starting with number 1. Full-body CT scans without a specific reason. It might sound thorough and proactive, but a full-body CT scan exposes you to a high dose of radiation, far more than a simple X-ray. For seniors, especially those without symptoms, this can increase the risk of radiation-related problems over time. Plus, these scans often detect harmless anomalies that lead to stressful, unnecessary follow-ups or even invasive procedures. Unless your doctor recommends it for a clear medical reason, it's better to avoid these scans just for peace of mind. Sometimes, too much testing can actually bring more worry than help. PSA tests for prostate cancer. This test measures a protein in the blood linked to prostate cancer. But after 70, many medical experts, including the U.S. Preventive Services Task Force, recommend against routine PSA screening. And here's why. The test often leads to overdiagnosis. That means detecting slow-growing cancers that would never cause harm. Yet once detected, these can lead to surgeries, radiation, and lifelong side effects like incontinence or impotence. For most older men, especially those with other health issues, the risks of the test often outweigh the benefits. Screening colonoscopies after 75. Colon cancer screening saves lives, no doubt. But after 75, the risks start to tip the other way. A colonoscopy is an invasive procedure that requires sedation and bowel prep, which can be hard on older bodies. There's also a small but real risk of bowel perforation or bleeding. If you've had normal results in the past and you're over 75, many guidelines suggest you don't need to continue screening unless symptoms appear. Talk to your doctor about safer options like a stool test if there's concern. Mammograms for frail or very elderly women. Routine mammograms are a standard part of women's health care. But past a certain age, especially in frail women or those with multiple health conditions, they might cause more harm than help. Why? Because detecting small, slow-growing breast cancers might not impact life expectancy at all, but can lead to biopsies, surgeries, and emotional stress. If you're a healthy, active woman in your 70s or beyond, screening might still make sense. But if you're dealing with other major health concerns, talk to your doctor. In many cases, it's okay to stop screening and focus on quality of life. Cardiac stress tests without symptoms. This one surprises a lot of people. You might think, better safe than sorry, especially when it comes to the heart. But if you're not having chest pain or other symptoms, routine cardiac stress tests can lead to false positives. That means the test suggests a problem when there isn't one. This can snowball into more tests, anxiety, and even unnecessary procedures like angiograms or stents, all of which carry risks, especially in older adults. If you feel fine and have no symptoms, you likely don't need this test. Here's the bottom line. Medical tests are powerful tools, but only when used wisely. As we age, our bodies change, and so should our approach to healthcare. Not every test is necessary. In fact, some can cause more harm than good. Always speak with your doctor before making changes. But don't be afraid to ask questions like, do I really need this test? What happens if I don't do it? And most importantly, will the results change anything about how we treat my health? Because at this stage of life, avoiding unnecessary stress, physically and emotionally, can be one of the healthiest choices you make. Stay informed, stay empowered, and stay healthy.